Assemblies within the Obuasi municipality are recommending restriction of movement of people following the upsurge of COVID-19 cases in the area. The assemblies at a joint emergency municipal security council meeting adopted a proposal from the Assembly's Public Health Emergency Committee for either a partial lockdown or curfew to be imposed on Obuasi. Chief Executive for the Obuasi municipality, Elijah Adansi-Bona, tells my colleague Ohim Interior of our health desk recommendations calling for the restrictions on movement of people would be forwarded to the presidency through the Ashanti Regional Coordinating Council. The recommendation also comes as the two assemblies record 456 coronavirus positive cases. The area has in the last 2 months seen its COVID-19 cases jump from 3 to 456, representing about 80% of total number of cases recorded in the entire of the Ashanti region.
Graph plotted now, I can say that almost every suburb has 1 or 2 cases, because if you have about 456 of them and you even share among the suburbs, clearly you can say that almost every suburb. But I can say that there are some few towns, especially those far from the main, the urbanized area, where we've not recorded cases. But the main, the urban center, talking of Obuasi proper, almost every suburb has a case. So we are advising that they shouldn't move. Initially, when one suburb was mentioned to have recorded a case, everybody was moving from that area to the other centers. And I'm telling you, and now I can say that that contributed to the spread. So everybody must stay at where he or she is, because you might not know where you're going, the state of the suburb. So let's stay, as we always say, if you move, the virus moves. If you stay, it stays. That will help containing the virus. For them, they want to reach the people at home. For example, if it is a curfew, and let's say it starts from 4:30 p.m., according to them, they can go to their homes after 4 and then reach them at home, take their samples. But if it is, let's say, lockdown, either partial or full lockdown, yes, you may have a lot of people at home, but you cannot also rule out the fact that people will go through hardship, because there are people who live on what they make every day. So if such people are being locked down, how are they also going to make it? We saw it during the Accra Kumasi and then the Kaswa one. So learning from that, I think partial or curfew, I don't want to, because my president is the best person to impose it on us, but we will make the recommendation. We are talking about the security agencies, the police, immigration, prisons, and the clinicians, talking about the doctors and the public health nurses who have been helping us in the fight against COVID-19, as well as the leadership of Obuasi East and Obuasi Municipal. We met yesterday and took decisions on some of the issues that came up from reopening of the market, enforcement, isolation centers, and what have you. So when we met yesterday, the clinicians also said something, that any form of restriction that can also enhance contact tracing would be appreciated. And I'm not an expert in terms of health issues. They have advised we would also escalate the advice to our bosses. So whatever decision that will be taken from the center, we have to respect that. But if you ask me, yes, either partial lockdown or curfew, but that can be announced by the president. So we're waiting for what the center will tell us. But we are doing our best before the center takes any decision and then impose it on us. I believe they know better, and whatever they do, whatever decision they take and then implement it, I know it will serve our people better.
In the meantime, fear has gripped residents of Obuasi following the increasing number of cases of COVID-19 there. Some residents are appealing to government to lock down the town as health authorities highlight challenges of halting the spread. They believe that further delayed action can worsen the mining town's case count, which is currently the highest, like I said earlier, in the Ashanti region. My colleague Ohemi Terry of our health desk has more in his report.
Out of a total of 483 COVID-19 cases recorded in the Ashanti region, Obuasi accounts for 272, making it the hottest spot for the virus. The town also has the highest number of over 4,000 samples tested. Authorities blame complacency and negative attitude of some residents for the upsurge in cases. Market women especially have been flouting social distancing protocols, forcing authorities to close Obuasi Central Market A and B to business indefinitely. Armed security personnel had to be deployed to ward off resistance from residents protesting the setting up of an isolation center. Health authorities appear to face a Herculean task in dealing with the human factor of the fight.
We should be so concerned about the figures. And not even only the figures, but if my sample was taken 3 weeks back and I've now had the results and it's positive, what happened from the day of the sample taking and the day I had my results? Where have I been to? Who and who have I mingled with? So it's a very big concern. It makes contact tracing very difficult because the case would have even lost remembrance of who and who they have had contact with. These people are not people who were sick. You know, it is community sample taking, voluntary community sample taking. So it means they were in their houses, they were at their workplaces, no sign of sickness. So then if you take my sample, I go about my normal duties with my colleagues, with my customers, with everybody. I go to the same market with any other person. And so my result came and I proved positive. So it makes it very dangerous.
In the midst of the dilemma, some residents want immediate lockdown of the new epicenter of the coronavirus in Obuasi.
When the cases start coming, we never expected because Obuasi, we are safe. But just 1 week time, we started confirming cases. And for about 1 week, we have confirmed about 256 cases. So it's dangerous living in Obuasi for now. I never understand why Obuasi was not part of the places they locked down because first 3 cases that they confirmed, one was from Obuasi. So what I was expecting from the president just last Sunday was Obuasi to lock down because checking some of the regions, Obuasi cases are even higher than some of the regions. So Obuasi should have been locked down even more than 1 week or 2 weeks because at least getting locked down and being safe is better than getting the virus.
In fact, I'm scaring because right now we don't know who tested the positive and we are all moving around. What I think is our opinion leaders and then the MCEs and DCEs have to come together and then consult the government if they can even lock Obuasi at least 1 week. Safety first, though it's hard. But at least 1 week is enough.
From Obuasi, Ohemi Terry reporting.
And we will be live in Obuasi, but in the meantime, some COVID-19 patients in Obuasi have been relocated to another isolation center under tight security. The transfer follows a successful takeover of the facility by armed members of the COVID-19 security task force. The COVID-19 task force last night forcibly broke into the private facility at Akaporiso suburb, put under lock and key by some angry residents. Residents who have been protesting over the siting of that center there locked and blocked the 2 main entrances and roads leading to the facility with padlocks and concrete blocks.
It's gradually becoming the epicenter of COVID-19 in the Ashanti region. The area, as at Monday, May 10, 2020, has recorded 261, more than half of 483 COVID-19 cases recorded in the entire Ashanti region. Local and health authorities are concerned with the surge in coronavirus cases despite efforts to curb the spread. They blame lack of attitudinal change on the part of residents, especially market women, for throwing caution, including social distancing protocols, to the wind. Health authorities met strong resistance from residents of Akaporiso suburb as they prepare an isolation center for some COVID-19 patients. The angry youth blocked the main road to the facility and put the main entrance under lock and key because the center could pose health risk to the community. They also packed concrete blocks to block one of the main entrances. After several attempts to convince the angry youth to rescind their decision failed, the Obuasi East Assembly resolved to use force.
We've given them enough education for about 2-3 days. We've spoken with them. The head directorate has gone to speak with them. The chief, the assembly member, the unit committee, we've met them. They are still resisting. So the next option is force. So today, all things being equal, we will have to send them there because we can't continue keeping them in their various homes because most of them share basic facilities with other people in their homes. So today we had a dissect meeting and we concluded that the security personnel should make sure that the people pave way for the patient to be taken to the center.
The community is not happy of the decision of the convent committee and the assembly to evacuate our brothers and sisters who have been infected with the virus to be isolated in that community.
At about 8 p.m. Monday, all was set for the COVID-19 task force to come face to face with the angry youth. Obuasi District Commander DSP Martin Asenso is leading the charge.
If the road has been blocked, we shall go there and remove them. If you have any person or persons gathered, we shall also arrest them.
The armed team forcibly broke padlocks to pave way for the transfer of the patients to the facility. In less than an hour, the operation was over. DSP Martin Asenso is the Obuasi District Commander. He says all isolation centers will be henceforth manned by armed security personnel.
The inhabitants went and locked the main door of the compound. They used their own padlock to, lock the place. So I have to break in to make access to that particular place. At the moment, we have put security there, 24-hour guard for that particular place, because if you don't do this, it will also affect other community that, when we are bringing this, the people say, I don't agree, why are you bringing this place? You know that. So this is what the decision the DASEC have taken, the convent committee have taken, they are going to abide for this matter.
From Obuasi, for JoyNews, Ohiminteria reporting.
I'm curious to hear from you if you live in Obuasi or its environs. What do you feel? How do you feel? What do you think about this story? Share your thoughts with us on our WhatsApp platform 0540109009. I'm going straight to Obuasi with you right now. Ohiminteria is standing by for us. Hello, Ohime.
Hello, Gifty.
Ohime, this is rather a bizarre situation the security authorities there have on their hands. The security and the health authorities there. What is the situation in Obuasi today after that operation last night?
For the relocation or transfer of the COVID-19 patients to this isolation center at Akaporiso, Obuasi suburb, I must say, since after that operation, nothing new has happened. There hasn't been any agitation, there hasn't been any attacks or whatsoever on this particular premises that was seized by these angry youths. So yes, police have put 24-hour security surveillance at the particular spot, meaning that nobody can intrude into this facility. And what we do know is that there are 2 isolation centers in Obuasi, and police is providing 24-hour security to all these isolation centers. But just yesterday, the Obuasi Municipal Assembly and that of the Obuasi East District Assembly had a joint Security Council meeting, and the decision that they took was that Because of what is happening here in Obuasi, first, there was a recommendation from the Public Health Emergency Committee, which proposed to the Assembly that because of the surging number of COVID-19 cases, there's a need to restrict the movement of people in Obuasi. So they are suggesting that either the government help introduce a partial lockdown or a curfew in Obuasi to control the surge in the number of COVID-19 cases, or restrict the movement of people. That will go a long way to affect the measures that they are introducing to control the spread. Gifty.
Speaking of which, that request came in, I think, yesterday. Have they received any feedback from the authorities that they forwarded the recommendation to?
Not at all. The meeting was held yesterday, and according to the Municipal Chief Executive Elijah Adansibona, the recommendations will be sent to through the regional minister, Mr. Simon Osemensa, to the Jubilee House, Flagstaff House, for approval. He tells me that it's only the president who can say he's locking up an area. It's above the Obuasi Municipal Assembly or the District Assembly, so they will wait till the president take a decision on that one. And he says these recommendations will be sent today. So it is too early to say the recommendations have been sent.
Interesting indeed. Let's talk about this particular isolation center that came under attack. What we have seen across the country is that communities will resist the attempt to bring in any people, in places that are set up as isolation centers. So government increasingly is hiding the identity of such isolation centers. How did the people know that this particular place they attacked was an isolation center? And what are authorities doing to make sure that the place that these people have been relocated to is not known to the people there?
Yes, Gifty, that remains $1 million question. What we do know is that probably residents sense or pick up these signals when health authorities or members of the COVID-19 task force visited this facility in question. Let me give you some background to this facility. It was built as a hotel, to be served as a hotel facility, but somewhere along the line, the owner rented the facility out to be used as a clinic in Obuasi. So all this while, the place is known to be a clinic, but the owners also decided to hand over the facility to the Municipal Health Directorate to be used as an isolation center. So I'm told even before authorities went to the facility, residents have already massed up, and every now and then they used to visit the area until they carried through the threat by first blocking the road leading to the facility, and also went ahead to put the place under lock and key, which means that they went to market, bought their own padlock and lock up the place. As if that is not enough, they also packed concrete blocks at one of the two entrances of the facility, which would have made movement or entry to the facility very difficult. So at the time that the security operatives besieged the facility, they had to forcibly break into the facility before the health authorities could prepare the facility for use as an isolation center. So the police have done what I would say a yeoman's job, because beyond breaking into the facility, they've also provided 24-hour security, which means that it will be difficult for anybody to intrude or to enter this facility apart from the authorized agents of the Ghana Health Service or members of the COVID-19 team. Okay. And I must say, if we are talking about hiding the identity of the positive cases, it is possible, because this facility is a walled facility. The walls are very high, and then it's also somehow secluded in a bit. So it will be difficult for anybody to see who will be sent to this isolation center. Gifty.
Ohimi, thank you so much for that update. We'll certainly appreciate all the reports that you keep bringing in, and we'll be relying on you for the rest. Ohimi Interior is on our health desk, also on our security desk. So this is as much a health story as it is a security story. Ohimi has been on that for us in that region. In the meantime, we're still in the Ashanti region. The Regional Health Directorate says it is sending a reinforcement team to Obuasi to help contain the spread of the disease. More teams of medical professionals from the region will be sent there to strengthen the contact tracing, isolating and treatment of the medical treatment by the medical teams. It has become very critical. Regional Health Director Dr. Emmanuel Tinkran revealed this to Live FM's Prince Apia in an interview.
The Ashanti region case counts currently stands at 662. Out of which Obuasi, the new hotspot, accounts for 80% of this number. Officials say about 100 infections in the Obuasi situation can be traced to 2 persons who tested positive. Regional Health Director Dr. Emmanuel Tinkran says the team from Kumasi will augment local efforts to contain the spread of the COVID-19.
The challenge we are having right now is with Obuasi community. But when at the initial phase, you realize that most of the cases were coming from Kumasi. But now it seems the trend has changed. For us, Kumasi has done so well to contain the infection. We are having rather the reverse in Obuasi. Initially, we thought that Obuasi could have managed, but this time their situation is not good enough. You don't know any person that you come across and you don't observe the protocols, the social distancing, the wearing of face masks may give you the infection. And this person can spread the infection over and over. So that's the situation that Obuasi finds. But one thing is that we are looking at the progress and then putting in the necessary intervention so as to reduce the spread in Obuasi. We've strengthened the medical team there, and we've redesigned another strategy. So now we are sending a reinforcement to Obuasi. And we believe that with this reinforcement and with other measures that has been taken by the municipal, Obuasi Municipal itself and the Obuasi East, we can contain the infection at Obuasi so as to cut the transmission and then save the people of Obuasi.
Okay, so the reinforcement in what capacity?
The reinforcement is that the medical team will have to be strengthened. The contact tracing will have to be strengthened. The principle of tracing, testing, isolation and treatment will have to be strengthened. So it means that we have to send more teams. And this is exactly what we are doing. We have to send more teams and make sure that we identify, isolate, and then those that will need treatment, we treat. So formerly it was only the medical team at Obuasi that was working, but this time the region has come in and has given the reinforcement that we all need to see.
Meanwhile, there have been calls to lock down the city in the face of the current development. Dr. Tinkran says it is necessary to assess the situation and weigh the pros and cons before a decision is taken.
We will need to assess this carefully, because as you all realize, the lockdown has its own implications and the challenges that's associated with it. So whatever decision or measures that we want to take in place should be measured. We should do a lot of weighing, yes, balancing act, so as to take the right decision. So though people are proposing lockdown and other things, but I always say that the best thing is for all of us to assess, and every decision will have to come from our president, and based on the advice that he has a technical team that will be given to him. So as I said, we will have to assess the situation and then weigh the merits of lockdown or not before any decision is taken. But whatever decision is taken, we'll make sure that we work within the framework.
He spoke to Love News when Samvik Mining and Construction Ghana donated anti-COVID-19 items worth 150,000 Ghana cedis to the Directorate. Samuel Brewu is the Human Resource Manager.
And we are grateful that we are of use in such a situation like this. Sandvik has a history of interventions in the areas that we operate in. Basically, The quantities are 400 nose masks, 100 per each pack, so 100 packs of hand gloves with a quantity of 100 for each pack. And then 500 milliliters hand sanitizers, we have 4,300 pieces to deliver to the regional directorate.
Meanwhile, the directorate wants more benevolent individuals and institutions to continue supporting with PPEs.
We need a lot of PPEs to work with. So we are very grateful that you've provided us with these PPEs. We will thank you and then ask that other benevolent donors should also come to our aid, because the number of cases are still going up. If you can look at the data, you realize that this is the time that we need more assistance. What we want to tell people in the Ashanti region is that our cases are going up. During the lockdown, we're having a lot of support, but this time it seems that the support has dwindled. So I would like to take this opportunity to invite all donors to come in and support the government, because the government is doing its best, but we still need other donors to support us.
Prince Apia reporting.
I'll take some of your comments. I'll go on a break. But before that, I'm going back to Obuasi. Ohime is still with me for a quick one on the market. Ohime, the market was also closed down because social distancing protocols were not being observed. That's something we left out. Tell us more.
Yes, Gifty, the market was closed down just last week by the assembly. According to the assembly, it was appalled by the fact that traders in the market, including patrons, were abusing social distancing protocols. They were not adhering to those protocols, and the numbers were so huge that the assembly estimates at least not less than 3,000 people visiting or patronizing the Obuasi Central Markets A and B. And so we later learned that the market has also become the epicenter for the coronavirus pandemic, when we learned a couple and have been the source of transmission for the virus. But when I spoke to Mr. Elijah Adansemona this afternoon, he told me that the assembly has been trying to group the traders into sessions, of which they are trying to also reduce the number of traders that will use the market facility. He says all things being equal, the market could be opened for the first time in about 1 week to the traders. And this time around, they are doing everything possible to reduce the numbers. The market is home to about 1,500 traders. And he tells me they are looking at 500 traders on a day. So only those who are authorized will be allowed to enter the market to trade their wares and also to patronize the market. But once they are also talking about the fact that there are recommendations for Obuasi, movement of people to be restricted in Obuasi, it is not too clear whether the market will be opened to the public tomorrow.
Right. Ohime, thank you for that update. Most of you are sending your comments in and you are backing that call by some people in Obuasi for the town to be locked down. I'll read some of that for you before we go on a very quick break. This one says, Farouk is sending this from Tamale. He says, the president has always been misled. The lifting of the lockdown is the cause of the high number of COVID cases. Hashtag stay safe, stay home. This one says the credibility of judges. We're talking about judges. We're talking at the moment about Obuasi and the cases there. He says, I believe the curfew is a way to go. Lockdown won't help at all because most of the residents will start moving out of the town as well, that essentially spreading the disease. Remember also that Obuasi was not part of the lockdown areas in the Ashanti region. Therefore, the surge in the confirmed cases may be due to those who moved from Greater Kumasi to Obuasi during the period. Yakub True from Wenchi Banda line send that message. And Peter from Techiman says the minority shouldn't. Okay, a lot of politics for you there, but we'll focus on coronavirus. This one says, seriously, Obuasi's problems has to do with unserious and non-proactive leadership. As it stands now, there's no proper education ongoing. The MCE and DCE are so relaxed all this while. It is really sad. You don't add your name. I still have a lot more messages, but I have to take a break now.